And welcome to the Dr. Bob Show. Have you ever worried about giving blood? Did you wonder what it was like? Oh, was it going to make you faint? Would you be too weak? How long would you have to be off work? Just lots of questions and lots of bad information. We're going to learn today about the value of your giving blood. It may save somebody else's life, and it may save your life, and we'll learn how that is. My guest is Mr. Jim Decker, CEO of Medic Regional Blood Center in Knoxville, Tennessee. I've known Mr. Decker for a long, long time. He's a great speaker, a great person, and his education list is longer than my body is. So you'll really love listening and learning about blood and what it can do for other people. Can it save your life? I think the answer is going to be yes. You'll want to stay tuned. I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. We're talking with Mr. Jim Decker. He's the CEO, Chief Executive Officer of Medic Regional Blood Center in Knoxville, Tennessee. Jim, welcome to the Dr. Bob Show.
Thank you. It's great to be here.
It's an honor to have you on this show. I've wanted so long to be talking about blood, but I always anticipated that we say a board-certified doctor. What's your education?
Actually, I am a doctor, but it's a doctorate in health administration.
Health administration?
Yes.
You're a doctor? You got your doctorate in that?
Well, I do. I sure do, yeah.
I looked at your resume, and you seemed like you had a doctorate in everything.
Well, I've got a few other degrees as well, but that was my terminal degree.
Are you a Tennessee fan or a Alabama fan? Or?
Well, probably more of an LSU fan.
No.
I grew up in Louisiana, went to LSU, and so that's part of my roots.
One of the doctors in our practice is an LSU nut. He
Dr.
knows,
Springer, yeah, absolutely.
And Mike Springer knows every player, every recruit, how fast they can run a 40-yard dash, what their vertical leap is, what their high school GPA was, and who their coach was.
I've been around Mike several times at some LSU functions. Great guy.
Yeah, and he's just a phenomenal person.
Right.
Where is Medic located?
Our main office is located right here in the heart of Knoxville, just north of the interstate, at the intersection of 17th Street, Ayler Avenue, and Western Avenue.
So that's right in the middle
Little triangle there. It's been there since 1989.
And every time I pass by it, it's got the best awareness sign I've ever seen. It says Medic.
Well, thank you.
Now, what does Medic mean to people?
Well, that goes way back, the name itself goes way back to the late 50s when Medic was created. And I can't tell you all the words in that acronym, but the acronym of Medic established a local blood center to serve our community. And that goes back to 1958 when it originally was founded by Dr. Carl Nelson, who was a physician in the community.
Yeah, he was, I think, a pathologist and a great physician also. Right. So tell me, what's the purpose of Medic?
The purpose primarily is to collect, process, and distribute blood to our hospitals in our region.
That word scares a lot of people when they talk about blood.
Right.
So is it dangerous to give blood?
Well, no, but it's not without risk. But, you know, people should not be concerned. Obviously, we need to insert a needle in their arm. So
is that scary?
That's scary for a lot of people.
Does it hurt really? Because every time I get stuck, it's almost like...
Well, everybody has a different level of pain. But it doesn't hurt in my way of thinking because the needles are pretty, you know, they're sharp. They go in very easily. Our staff is very skilled to know...
Let's talk about your staff. Who is the person that sticks that needle in?
Well, the term we use most often is a phlebotomist.
Phlebotomist.
Right.
So that's a professional name for?
That's the people who collect blood, okay? Hospitals have phlebotomists on their staff that they go around to different patient rooms to collect blood. We do as well. Now, quite often those phlebotomists also have additional training. In our case, we have some who are EMTs, some who are LPNs.
What's an LPN?
Licensed practical nurse. Yes.
And so they're well trained, well guided.
They are.
What kind of education does MEDIC, do you as the CEO, give those people that are performing services for your business?
Well, we give them a fairly elaborate orientation and basic education specific to the blood industry. And the reason I say that is we operate under a different set of guidelines than a hospital would. The FDA, the Food and Drug Administration, governs and regulates the blood industry, and they have very specific guidelines as to the training of our staff and what needs to occur before they can even come close to sticking a donor.
Are there requirements to give blood? How old do you have to be? And when you reach 99 or 100, can you still give blood? What's the onset of when you can give?
Right. 17 is the age in which people can donate on their own. Now, we do allow 16-year-olds to donate with parental consent because we do a lot of blood drives in a lot of hospitals. Okay.
Yeah, and it's always nice when I look at the MEDIC vans that say we'll be here on what day. And you do a great job of really teaching the public when you'll come by.
Right.
But if somebody said, well, I heard it by the gossip line that you might fall on your nose as soon as you walk off the table frequently, and they have to take you to the hospital and resuscitate you and all this.
No, that's actually very rare. We take a lot of precautions to make sure that our donors have a very relaxing environment. We basically require them to stick around after donating, drink some fluids, eat a cookie or a cracker, make sure that they're not dizzy, make sure that they're not lightheaded before they get up and walk away.
So there's a common medical condition that people, when they're stuck, that they might faint. And that really is something we try and prevent. The fainting is not dangerous. People wake right up, but some people look at blood and they begin to feel lightheaded and faint.
Everybody gets queasy looking at different things.
So I've given blood 10 times. How frequently can I give blood?
You can give blood every 56 days.
Every 56 days.
Now, when I say that, I'm talking about a unit of whole blood, okay? And we can get into that a little bit later. But if you give or donate a unit of whole blood, your body is going to take 56 days in order for you to replenish the red blood cells that we took from your body.
Am I weak during that period of time? Can I go out and play a game of basketball 2 days later?
Probably during the first 24 to 48 hours, it'd be advisable not to go out and do anything very strenuous. There was a point in time early in my career where I actually did that. I donated blood and went and played in a basketball league one night, and I learned very quickly that was not the right thing to do. So no, we advise people not to engage in any strenuous activities. You don't want to go out and lift weights and run the risk of reopening the site.
So I was basically like you were when I gave blood, and at that time I went out and played a basketball game or did something, and I never noted the difference at all. It was just like playing a basketball game.
Well, when you're in your 20s and 30s, sometimes you can get away with things like that, but it catches up with you over time.
So there's an age limit. How about the upper age?
Really no upper age. We actually have some active donors in our donor base currently that are age 90 and above, if you can believe that.
So that's not an excuse. Well, I'm too old to give it, or are you on any medicine? You're not too old, you can give it.
It's mainly their health status and what medications they may be on.
So how do you know if a patient's healthy or not? What do you do to find out if that patient is healthy enough to give blood?
Okay. Well, as I said earlier, we're regulated by the Food and Drug Administration. So there's certain requirements that we have to go through prior to allowing someone to donate blood, one of which is a very brief physical exam, temperature, pulse, blood pressure, those types of things, just to make sure that they're feeling healthy and well today.
Do you get any blood values that are free for the patient?
We get a hemoglobin value, which gives us an indication of the oxygen capacity within their blood, oxygen carrying capacity.
And that's what we're going to be talking about when we come back. How do they get the blood? What actually do you get? What happens to the blood when they give it? Do you give it right to a patient right next door? Or what are some of the precautions and requirements? And how safe is getting the blood when you have to give it to somebody else? I'm not going to give away the answers, but I know what they are. You're going to want to stay tuned. We're talking with Mr. Jim Decker, the CEO of Medic Regional Blood Center in Knoxville, Tennessee. They've got different locations. The main one is at Ayler and 17th Street. And then we talked about how safe it is. Who should be giving blood? Everybody. You got to be 16 with parents. You got to be 17. You can come in by yourself. And up to 99 and a half, you can give that blood. So great information. Feel free about giving blood. Let's talk about the blood they give. What is blood like? I know it's red and it's there and it comes out when you stick your finger.
Well, let's start with the basics. Generally speaking, people will be able to relate to the fact when they donate a unit of blood, roughly a pint, 500 milliliters, okay? It's a unit of what we call whole blood, meaning it has all the components in one bag. We take that blood bag and we actually centrifuge it and spin it down to where the red blood cells then migrate to the bottom, and that separates the red blood cells from the plasma.
So the plasma is clear, not red?
The plasma's clear. It's got a yellowish tint to it, but
it's been hiding inside with those red blood cells.
That's the fluid that your red blood cells flow into.
Yeah.
Now we separate those two because clinically, in the hospital, some patients will only need red blood cells. Other patients may only need plasma. Then there's another small component that's very important called platelets.
What do platelets do?
Platelets facilitate the clotting mechanism in your blood. If you cut your hand working out in the yard, it starts bleeding, within a few minutes it'll start hardening and create a scab. Platelets are the rushes to that wound to help clot that wound.
And the red blood cells, what are some of the things that they do?
They carry oxygen throughout your body, okay?
So when I breathe in, the oxygen that I breathe in hops onto the red blood cells.
Actually in your lungs, okay? There's an interface between the circulatory system of your body, the arteries and veins, and it goes through your lungs, and it's in that process oxygen attaches to the hemoglobin, which is on those red blood cells.
So that's where hemoglobin is. It's in those little red blood cells.
It's in the red blood cells.
So what's an hematocrit?
And hematocrit is basically the percentage of red blood cells that are in your blood. Okay, so when we spin that down, the percentage of red blood cells compared to the entire unit would be the hematocrit.
And what do you use the plasma for? You have to throw it away?
No, actually, there's a couple of different uses for it, some of which we can use clinically, to transfuse into patients that may need plasma. We can freeze it to where it actually can stay frozen until it's thawed and then used at a later date.
Now, let me stop here and let's go back to one thing.
Okay.
I forgot to ask. When you draw a pint of blood from me, how safe is that? How do you know if that blood is safe that I'm giving you? Okay. What do you have to do to make the blood safe?
Very important question. Probably the most critical part of the process actually happens behind the scenes, and that's where every unit of blood is tested for any type of blood-borne disease, anything that could be transmitted in the course of a transfusion.
So there's lots of diseases that the blood may carry, and you wean that blood off.
Absolutely, and there's a whole list of those type of diseases that are tested for before it's deemed to be safe to be transfused to a patient's body.
When you drew a pint of blood, you tested it, and you found that I had a rare illness, or that I was jaundiced, or that I had something, do you notify me, or you just say, tough luck, boy?
No, we'll notify you. If there's something that is detected as part of that process that's of concern clinically, we'll notify you. Now keep in mind, the testing that we do, we actually send it to a testing lab, but it tests specifically for those blood-borne diseases. It's not the same blood test that you'll get when you go to your doctor's office, who's looking, doing more of a diagnostic test. So it's a different type of testing.
So you store that blood when you take it and get it purified. How is it stored?
Well, the red blood cells are stored in a refrigerator, okay? And it can be stored up to 42 days.
42 days.
It has to be used within 42 days before it has to be discarded. See, it's got a life cycle there.
Do you ever find yourself in a situation where you have leftover blood, or you find yourself in a situation, we've got to get some more donors in here?
Well, we generally find ourselves more in a situation of needing more donors. On those occasions where we have blood that is being close to expiring, we will contact other blood centers across the country, and quite often they will need that type of blood so it doesn't go wasted, okay?
You said type of blood. Are there different types?
Different types of blood, yes.
Is there a universal donor?
Yes.
Is there a universal recipient, or essentially?
Sure. Well, let's talk about the 4 primary blood groups, O, A, B, and AB. Okay?
Which is the most common?
The most common is O positive. So see, that's the other thing. There's an RH factor associated with each of those types.
What's RH mean?
It's the rhesus blood.
Yeah, so what it means is whether the blood is safe or going to cause a reaction.
Right, can cause a reaction in someone's body. So O negative, that would be an O blood type without the RH, is the universal donor. It could be given to any blood type.
So if you got into crisis management and you didn't have time to test it, run it through all the precautions, you can give it, cross your fingers, and it should be.
And because of that, it gets used very frequently in a clinical setting, particularly in a trauma situation where you don't know the blood type of the individual and the blood has to be given immediately. Typically, O negative will be ordered to be transfused.
So if a patient's in the hospital and they're bleeding to death and they, for some reason, didn't have type and cross, you could say, call up a O negative person and say, could you come in and give us some blood? There's a patient that's dying if you don't come in.
Now here's the problem. Yes, that's correct. Only about 0.6% of the population is O negative. And yet they're the universal donor, and it gets used most frequently in hospitals. So O negative donors are very
valuable.
Thank you. Extremely valuable. In our area, about 14% of the blood that's administered in our hospitals is O negative. So we're collecting blood from a very minuscule percentage of the population, and yet it gets used very frequently in a clinical setting.
So they really are valuable. Do you have a list of all your O negative people?
We do.
Yeah, and so
we do.
Are they on call?
Yes, they are. In fact, just this past year, we created what's known as an O negative program for that very reason, and several of them have agreed to be on call in the event we need them immediately, as long as they're eligible to donate, as long as they've passed that 56-day window of time.
So why 56 days?
Well, that's how long your body, the FDA has established that that's how long it takes your body to replenish the red blood cells.
So you got red blood cells that are running around, and every 56 days they run out of their life, and the bone marrow makes more. So when that is established, what's the next thing?
Well,
That's what we're going to be talking about. When we come back, what happens after we establish the blood type and we can give it and then we can store it and we know what the plasma and the hematocrit and all of the components of the blood, of the safe blood's there. So know that it's safe as safe can be. And if you hear war stories about something that happened that probably may have been a rumor. You're going to want to stay tuned for what we'll talk about next. We're talking with Mr. Jim Decker. He's the CEO of Medic Regional Blood Center, Knoxville, Tennessee. And we've learned about giving blood, preparing the blood, who can give blood, what are the requirements, what are the guidelines, how careful are they, what do they have to do with the blood, how long can you keep it, how long before you have to replace it. Need more donors than blood is ever left over. So think about your giving blood. Jim, what kind of medical supervision do you have? Are there doctors there?
Actually, we have a full-time medical director at Medic.
A doctor, MD?
He's an MD.
What's his
has a pathology training, specialty training, but also has additional specialty training in transfusion medicine.
In transfusion medicine?
Yes.
With a degree in that?
Yes.
Did he have a degree? Didn't you say something about microbiology?
Well,
whatever
he has a PhD in molecular biology, so he's very well trained. Yes.
He's smarter than I would ever think about being. And so his purpose?
His purpose is to provide medical guidance for everything that happens within the blood center.
So what work does he do inside?
He gets involved very actively on a daily basis in terms of determining donor eligibility. Meaning, if someone were to come to us wanting to donate blood and for some reason there's a question, do they meet the criteria? What medications are they on? What their health background, health status is? They will call Dr. Watkins and he'll give them guidance based on his medical understanding as to whether or not that donor is qualified to donate.
And so there's some illnesses that leave the bug in the blood.
Yes, unfortunately, we call that a permanent deferral sometimes.
Yeah.
There may have been an illness that that particular donor has had sometime in their lifetime that don't meet the specific criteria that the FDA has established for us to follow.
From a patient standpoint, from my standpoint, to know that you've got Tom Watkins, who sits there as a super MD, not just an MD,
right,
who is so very well educated and goes around with your Medic bus and makes sure that everybody's eligible and any questions they have, you have an MD there to answer them. Is that correct?
That's correct. Well, he's not in every location all day, every day.
You're always very careful and precise.
But he's available by phone, and he gets consulted all throughout the day.
So he's pretty busy.
He's very busy, yes.
What time does he usually leave?
He leaves anywhere from 5 to 6 o'clock in the evening, yeah.
And that's real dedication, really.
Right.
So we thank Tom Watkins for everything he's done. We thank Dr. Michael Springer for being an LSU fan.
Yeah.
And we thank Mr. Jim Decker. What an outstanding job. I hope you'll come back with us again.
Well, thank you. I appreciate you having me on. It's important, and I hope people appreciate the need for blood. I would encourage everyone to consider donating. We serve 24 hospitals throughout a 22-county region. And so each and every day there are patients in those hospitals that need blood, and we're there to provide it for them.
So my urgent request and my plea for the viewers of the Dr. Bob Show is think about giving blood. Think about how it can save lives. And if you give blood, then what happens? Do you get free blood from then on, or what?
Well, we have what's called a membership program, and that is somewhat unique to Medic, to where if you donate a unit of blood and do so each year, you maintain an active membership. And what that does for you is, in the event that you need blood or any of your dependents need blood, then we cover the processing cost for that blood that's provided for you.
That's great service. In order to have healthy blood, you've got to be healthy. What do you have to do to be healthy? Well, you've got to do the 4 things that we talk about on the Dr. Bob Show, every show. Number 1 is exercise. When we exercise, it actually stimulates the bones to be stronger, and the bone marrow is where blood is formed. And so exercise is good to keep you red-blooded American people, not males, people. So be sure that you're exercising. It also causes new blood vessels to form around the heart. It lowers your blood pressure. It takes away stress. It's the best thing you can do. Eat properly. We all know what we should be eating, and we all cheat a little bit. So be sure that you've got fruit and fiber and vegetables. Look it up. They're in front of us every day, and be sure that you eat the right kind of foods and try not to cheat. 7.5 hours of sleep. Well, I don't need 7.5 hours. Yes, you do. And the literature clearly says if you get 7.5 hours of sleep, you'll perform better. Your immune system will work better. You'll get less illnesses. You'll be able to give blood better because you'll be a healthier person. So be sure that we're getting that 7.5 hours sleep. There's nothing like it. There are some 100 sleeping disorders. So if you find you're not sleeping well, talk it over with your doctor and he'll guide you to a sleep specialist. And what is it that we need the most in the Dr. Bob Show? It's that laughter in your life. Find a loved one or somebody that you associate with, tell stories, giggle a lot, laugh a lot, and you'll stay healthy.